So, hi, I'm Dr. Claudia Gomez. I'm a pediatrician here with Pediatric Associates, and it's a very exciting week for us pediatricians, and I know for a lot of parents out there as well. This week, Friday, the FDA issued an emergency use authorization to allow the use of the Pfizer vaccine in children ages 5 to 11. And the CDC is recommending that children in this age group become vaccinated. As far as the clinical trial, it enrolled initially about 2,200, a little over 2,200 children. That has expanded now up to about 3,100 children. In this age group, they did reduce the dose. It is 1/3 of what children 12 and up are receiving, and it's given in the same 2-dose series that's about 3 weeks apart. However, even with this dose reduction, they showed comparable efficacy with the vaccine. So in this age group, about a week after the second dose vaccine, it's showing that it's 90.7% effective at preventing severe COVID or symptomatic COVID infections in the children. As with some of our other vaccines as well, some of the more common side effects that we see are going to be your pain at the injection site, redness, swelling, headache, muscle aches, things that we tend to see with our other pediatric vaccines as well. In this age group, some of the great news that we have received is that really severe reactions were not reported. There were no cases of myocarditis as of yet in this age group, and they have been followed for now about a 3-month period after the second vaccine. As far as long-term side effects from the vaccine, what we see is that in general, for most children, we're going to see this anywhere between 6 to 8 weeks after receiving a vaccination. And so far, we're not seeing this in this age group. So the Pfizer COVID vaccine in children 5 to 11 seems to be very, very well tolerated. And we are seeing, for the most part, the same thing in our children 12 and up as well. Now, most parents, or a lot of parents, are going to ask us why vaccinated children are low risk. And that continues to be true. Yes, for most kids, COVID-19 is going to cause just mild symptoms. And this applies to the Delta variant as well, but low risk does not mean no risk at all. So children still do get hospitalized with COVID, and for some, the sequelae is going to last beyond that initial infection. Some comorbidities like asthma, diabetes, they do increase your risk of complications, but about 1/3 of the children who have been hospitalized don't have any comorbidities. Not only does it reduce the severity of the symptoms in the children who are receiving the vaccine, but it does reduce the overall transmission of the infection as well. And in turn, this is going to help prevent new variants. So as the virus spreads, it has more opportunities to change. And so preventing infection is going to help prevent new variants from forming. We're all ready to get back to some resemblance of normalcy, and vaccines, masking, good hand hygiene, those are all important things to help manage this and achieve this. And as a pediatrician, as a mother, I have 3 children. 2 of them are now eligible to receive the vaccine. Those 2 children will be vaccinated. And I know this is a choice that parents have to make. I completely get hesitancy. I get anxiety surrounding this choice. And I invite anybody who has questions, parents, to reach out to their pediatrician, to their family doctors as well, to answer some of those questions parents may have.
So we can open it up to questions.
Have you treated pediatric patients with COVID?
I have. And for our children, like I mentioned before, it has varied from they were positive because they had some exposures from family members and really had no symptoms at all the way to multi-inflammatory syndrome of children. So COVID looks different in everyone. And yes, we have treated children.
What would you say to those parents who are worried about the vaccine and are more comfortable because we're hearing that children don't show symptoms once they, or mild symptoms once they get COVID, if they just want to rely on natural antibodies?
Sure. And the thing with COVID is that we don't know who's going to develop severe symptoms. And, at one point we thought it wasn't affecting children as much as it is what we're seeing now. So it's a guessing game about who's going to be affected with COVID. So as far as the vaccines, it's more something that we can control. We know the possible side effects of the vaccine up to so far. We know that with COVID-19 so far, the immunity, it may not be for too long. We have seen reinfection cases as well. With the vaccine, even though antibodies may wane over time, it's still, months after children have been vaccinated, it still seems to provide protection against severe symptoms.
In your experience when treating pediatric patients with COVID, who is showing the most symptoms? Is it those who are healthy, or those who have underlining?
All sort of children. So we have both healthy children that show severe symptoms. We have children who may have a comorbidity as well that have severe symptoms too. So at this point, we can't guarantee that a child with COVID-19 isn't going to have severe symptoms because they don't have underlying disorders.
So it really is just, I mean, you don't know who's going to show symptoms or not. And by the way, you're breaking up a little bit, just so you're aware of that.
Yeah. Probably just the connection. The big garbage truck went through here,
Oh, that's right.
Anything else?
How, as far as vaccination rate in schools in AISD in this area, is that something that you guys are going to keep track of when it comes to this age group?
No, and I don't have numbers yet. Our children 12 and up have already started receiving the vaccine, and those are not numbers that we keep track of. So I don't know what percent of my children, my patients, have received the vaccine so far. It's something that I discuss with them at every visit, but it's not, I don't have numbers for that.
And Lynn, can I just clarify, Abilene hasn't started receiving the pediatric doses at all yet, is that correct?
Oh, you're kind of breaking up, Heather. I think you asked if anywhere in Abilene has been receiving vaccines. Not that I'm aware of. I know the few, the few of our Hendrick pieces that do request those vaccines had not received them as of yesterday.
And you haven't been given any kind of timeline of when they might arrive?
No, I don't know. I did not ask that question. So I don't know. I know the city is also requesting vaccines. I think it's also new, do you want me to try to find out if we have a timeline?
That would be great, please. Yes.
Okay, I can do that.
Do you know what the how the process is going to work? Is it going to be like when adults first started getting being able to get their vaccines, go online thing, wait in lines? Do we know anything about that?
We don't know yet, and pediatricians will offer it in their clinic, and some pharmacies will offer it as well, but we're still working with the process.
Thank you.
And again, Annette might have her processes in place already, but I'm not sure at the